Prior to surgery, patients are required to visit the pre-op clinic. Patients and their families should understand what a total hip replacement is and what the surgery entails. The hipsters discuss with the patient what to expect during their hospital stay and what to expect once back at home. Patient education and teaching is important for optimal recovery. Patients are informed of surgical procedures, pain management options, potential complications, hip positioning precautions, rehabilitative exercises, and home health care resources. Patients and their families should be advised that home modifications may be needed following discharge. This is to ensure a safe and comfortable environment and to prevent another injury from occurring. There are several precautions involving post-op mobility. Hip positioning precautions begin immediately after surgery. Successful recovery is dependent on patient adherence. 3 movement restrictions for 3 months include: Number 1, no adduction across midline. This includes leg crossing or scissoring. Number 2, no internal or external rotation. This includes no twisting or turning. Number 3, no flexion beyond 90 degrees. Flexion is limited and knees should be lower than hips. Such movements are discouraged to prevent dislocation and to keep ball in socket while ligaments are healing. During the preoperative assessment, nurses are required to complete a preoperative checklist 24 hours prior to surgery. Medical history and records, including lab work, chest X-ray, and EKG, are documented, as well as vital signs, allergies, identification, and personal belongings. Patients are required to fast prior to surgery to prevent the risk of pulmonary aspiration. Nurses should always ensure correct identification of the patient, as well as correct identification of the body part to be operated on. The decision to have total hip replacement surgery can create fear and anxiety for many patients. Research has shown that physiological stress, such as anxiety, can impede the healing process. The use of anxiolytics or benzodiazepines, such as lorazepam and oxazepam, are used to reduce anxiety and induce sedation. Once the patient is in the operating room, several anesthetics may be used to produce unconsciousness and pain relief. The decision of what type of anesthesia used is discussed with the anesthesiologist prior to surgery. 2 types of anesthetics commonly used for arthroplasty include general or regional anesthesia. Anesthesia can be achieved with a combination of an inhalation agent, oxygen, a narcotic, and a neuromuscular blocking agent. All members of the surgical team use sterile techniques to minimize the risk of infection. Intraoperative prophylactic antibiotics may also be used. Surgical duration is approximately 2 hours. The postoperative stage is the final phase of the patient's surgical journey. The length of stay is dependent on the individual patient's recovery, but is generally 3 nights or less. Critical nursing care is important during this period. Nursing assessments and interventions of postoperative patients help identify and prevent the risks of postoperative complications. A thorough head-to-toe assessment may be completed using a physiological systems approach. Nursing assessments of the following systems may be used: the neurological neurosensory system, the oxygenation respiratory system, the neurovascular cardiovascular system, elimination GI/GU system, protection and integumentary system, mobility and musculoskeletal system. Temporary disorientation is common following surgery. It is important to assess the patient's level of consciousness to ensure that they are alert and oriented rather than sedated and non-responsive. Pain assessment should be carried out regularly and can be done through the use of tools such as the pain scale or low TARP. Post-op pain may range from mild to severe. A primary nursing goal involves reducing patients' pain through the use of narcotics, ice, or anti-inflammatories. Narcotics may be administered orally or parenterally through IM or IV procedures. Ice may be used to reduce swelling and should be applied for 20 minutes on and 20 minutes off. Following surgery, patients may require a PCA pump or patient-controlled analgesia to help relieve postoperative pain. Monitoring PCA pumps are important to ensure that pain relief is effective. The number of doses administered should be checked regularly and documented. Elderly patients may be sensitive to pain medications and should be considered when giving narcotics. A lower dose may be required. Following surgery, it is important to assess the patient's airway. Ensure that the airway is clear. Auscultate and assess the quality and rate of the patient's respirations. Ensure that there is clear entry to all lobes, apex, and bases. Common postoperative complications include pulmonary atelectasis or partial lung collapse. Such complications can be prevented through proper nursing interventions such as position changing. Frequent position changing is important for patients who are on bed rest. This prevents fluid from building up in the lungs. Incentive spirometer. Patients may be required to use an incentive spirometer. This device is used to improve functioning of the lungs and should be used 10 times every hour while the patient is awake. Deep breathing and coughing exercises should also be used. Neurovascular checks are critical for orthopedic patients following surgery. Patients are at high risk for developing neurovascular complications such as compartment syndrome, an increase in pressure in the muscle compartment. Signs of pain, paresthesia, paralysis, pulselessness, pallor, or poikilothermia may indicate compartment syndrome. Color, warmth, movement, and sensation, plus pulses, plus edema, is an effective assessment to ensure proper functioning of extremities. Because patients are on prolonged bed rest, the evaluation of weakness, numbness, and poor circulation should be considered. Nurses should encourage dorsiflexion and plantar flexion of limbs distal to the point of injury. Have the patient push their foot down on your hand like a gas pedal and pull ankles and toes up towards their nose. Monitor vital signs regularly or as needed. Following surgery, it is important to assess for nausea and vomiting. Auscultate the abdomen for bowel sounds. If nausea and vomiting are present, medications such as antiemetics, antacids, histamine H2 antagonists, proton pump inhibitors, and glucocorticoids can be used to reduce symptoms. Reestablishing normal calorie and fluid intake is important once patient is stable. A regular diet should be followed as tolerated. Assess intake and output. Patients may require a Foley catheter for 24 to 48 hours following surgery. Postoperative complications such as urinary tract infection can be avoided through proper assessment and by encouraging fluids. Constipation due to pain medication is common. Preventative approach may include ambulation and increasing of fluids. It is important to monitor and assess the wound site and dressing. Check to ensure that dressings are dry and intact. Dressing changes should be done using sterile technique in order to prevent infection. Closed section drains, such as the hemovac, are commonly used for 24 to 48 hours after surgery. Nurses should monitor the amount of blood loss and check patient blood pressure regularly. Patients who are on bed rest should be frequently assessed for pressure ulcers at the heel and sacrum. Frequent position changes are a preventative approach that promotes circulation and prevents skin breakdown. Mobilizing patients should be done with care. Nurses should assess patient stability prior to ambulation. Patients are encouraged to ambulate early following surgery to prevent the formation of a thrombus and pulmonary emboli. Venous thromboembolism, or VTE, is a common postoperative complication that occurs following orthopedic procedures. This term includes the development of deep vein thrombosis, DVT, and pulmonary embolism. Nurses should encourage patients to do foot exercises such as rotation, flexion, and extension of the ankle to promote venous return and prevent blood from pooling by increasing circulation. Anti-embolism stockings, or TED stockings, should be used as ordered. Care must be taken to follow proper hip positioning precautions, and nurses are required to remind patients of these restrictions while in hospital. It is important to educate patients of the importance of these restrictions until discharge.